In Isleworth, southwest London, 34-year-old human resources officer Annie is taking her beloved Cecil for his typically noisy daily outing.
Cecil's my 3-year-old French Bulldog, so I've had him since a puppy, and I treat him like my little baby. Good boy, Cecil!
Unfortunately for Cecil, exercise is no walk in the park.
Whenever we go and walk him, he just runs out of breath and he can't really breathe properly, so he starts making like this gurgling noise. Because it's really scary, because it looks like he's going to pass out, so it's not nice to see or hear him like that.
With the condition getting worse, Annie is now seeking Scott's advice.
Come on, Cecil.
Hi, Annie. How are you? You okay?
Yes, yeah.
Yeah, what's been happening?
So, Cecil can't really breathe at the moment when I take him for short walks, so he gets really out of breath.
He sounds awful, doesn't he? Hey, mate, you sound like a broken washing machine, don't you? How long have you been running for?
Just like a couple of minutes, not long.
A couple of minutes and he looks like that?
Yeah, it gets really bad.
Oh, Annie,
Cecil.
that's not good. Buddy, what is all that noise, eh? You've only worn for 2 minutes. I've known cases of this where the dogs have literally just passed away immediately, so we should get into the practice straight away.
All right, then.
All right?
Yeah.
Come on, mate. My plan is that we need to take Cecil straight back to the practice because he is really struggling to breathe. He is a risk to himself breathing that badly, and I'm very concerned. So I do need to get him back to the practice and understand exactly why he's breathing this badly. There we go. Come on. Let me carry you. Uncle Scotty's got you. Come on. Mate, that breathing is shocking.
Do your hair. You have yellow ones in today.
A few miles away in Teddington, spoiled Shih Tzu Honey is being preened before she sees Scott.
Oh, she looks beautiful.
Owners Nikki and Barry are feeling anxious about their 10-year-old. Honey was born with a serious heart murmur and 6 years ago contracted inflammation of the brain. She's been on medication ever since.
She's a lovely girl, aren't you?
I always say Honey's like an inspiration. Whatever happens, she just goes in and gets on with it. And you watch it and you think, how can such a little creature have such a big heart?
Good girl.
But now, Nikki's noticed yet another problem with Honey.
Give us your paw. About 2 weeks ago, I'd noticed that there was something sticking out around her stomach, so I had a little feel of it, and she didn't seem to be in any pain. And then over the next few days, I monitored it, and it looked like it was getting bigger. I'm just hoping it's not cancer.
Come on, let's go. Where we go?
Let's go, baby. She definitely is a fighter, and I think Honey will be able to get through it.
This noise is just incredible.
At the Isleworth practice, Cecil's owner Annie is hoping Scott can find a solution to her 3-year-old French Bulldog's chronic breathing problems.
Have you found at all that he has actually collapsed completely?
He'll collapse on all fours. He has been sick in the past, like after running or during running, he'll just like get sick all over the grass.
Oh my goodness, mate. That's terrible. That's just not a way to live, is it? Eh? To make sure that I'm covering all the bases, I just need to check Cecil's heart and lungs. All right, so what I'm going to ask you to do, Annie, is just to try and close his mouth a little bit for me.
Okay.
Just to try and stem the noise, just while I have a listen to this chest. Good boy, yeah, you good boy. What am I doing? What am I doing? All right, okay. All right, right. So, there is some good news in that his heart and lungs both sound perfectly fine. So he is a nice, strong, healthy boy. Everything from the chest down, perfect. It's from the neck up that we've got real issues here. He's showing all the classic symptoms of a very common condition in French Bulldogs called BOAS syndrome.
Oh.
It is a syndrome where they have been bred to look a certain way, and unfortunately that's led to problems. The main problem is that they've got a really short nose and a sort of flat face. And as a result, all the soft tissues in the back of the throat have been shunted back. And also, his nostrils, as you can see, are really very tiny. So the noise that you're hearing is actually the turbulence of the air flowing through the airways to go in and out. And you can tell there's quite a lot of turbulence going on. So he's not being very efficient in taking in the oxygen, taking in those breaths and then breathing out again. That's why he's out of breath. That's why he's panting. And that's why he collapses.
Okay.
Scott wants to operate as soon as possible on the beleaguered Bulldog. Cecil will now rest up quietly before his surgery.
First of all, I need to perform a general anaesthetic on Cecil in order to be able to look down his throat. My guess is that he will have an elongated soft palate and that will need trimming, but I can definitely see that he has a tiny little nostril slits, and so Cecil needs a nose job. What do you think about that? Yeah, you're unimpressed, but you're going to have one anyway, I'm afraid. Hey, you'll still be beautiful. Yeah, but you'll be able to breathe and play with your mates. Doesn't that sound good? Yeah.
Over at Scott's and Margaret's practice, head vet nurse Emma is about to get a big surprise for her birthday.
Morning, Elle. Hi, Emma. Happy birthday.
This is for me.
This is your birthday treat.
Who's this?
This is George.
Hi, George. What are you doing hanging out on reception?
I see this beautiful ginger cat sat on Elle's lap and he is gorgeous. I wonder if Elle's got me a really awesome birthday present, but I'm suspicious there's a little bit more to this story.
Earlier today, the ginger cat was dropped off at the clinic after his owners could no longer look after him.
Oh, that's a shame.
So he needs a forever home, but I need you to look over him.
All right, George, let's have a quick checkup.
I have totally lost my heart, George, and I'm hoping that Emma will too.
There we are. Oh, you're going to get weighed? Oh, hello, little man.
3.5 kilos. That's, for a cat this sort of size, he really should be about 5 kilos or so, at least. I mean, you can feel all of his hip bones, you can feel his spine, you can see he's got no muscle on his back legs at all. Everyone will agree that he really just needs feeding up to start with.
We could do a bit of grooming as well.
Yeah.
Don't you think his fur's looking
I mean, his skin is all, like, you can easily see his skin through his fur, so his fur is not in a good condition at all. Oh, you poor little man.
Well, you're in good hands now.
Oh, let's have a little listen to your ticker. Listen to the purrs in this cat's chest. It's ridiculous. If you can hear a heartbeat out of this, you're a better nurse than me.
It's just purring.
I can't hear anything. I literally can't hear anything. We have been saying for a while that we should have a practice pet. Do you reckon Scott would let us keep him?
Well, you can only ask, Emma, can't you?
Because it's my birthday, I reckon I've got some power here.
Yes, definitely.
Hey, do you want to stay with us, George?
Oh my God, he's actually melting my heart a little bit. This is ridiculous.
Come on, let's go. Where are we going?
Let's go, baby. Where are we taking you?
The beautifully groomed Honey has now arrived at the Richmond practice for her consultation with Scott.
Let's go, baby.
Hi, guys.
Hi, Kirsty.
How are you?
Fine, thank you. How are you?
Honey. Did you want to have a seat?
Yeah.
I'll be with you in a minute.
Thanks.
Owners Nikki and Barry have recently noticed a large mass growing on the Shih Tzu's abdomen.
I can't even imagine what it'll be like if she's got something serious wrong with it. She's my absolute everything. She's just everything. Yeah, she's come so far with us. 10 years, she's been like my best friend. She's like my daughter.
Good morning, Barry. How are you? Hi, Nikki. How are you?
How are you?
Very good. Hello, honey. Oh, wow. Look at you two matching today. You look absolutely beautiful. All right. Yeah, well, yeah, you as well. You as well. All right, then. Come on in. Let's have a little chat. Come on, gorgeous.
Come on, baby.
That's you, Barry. So if we just pop you in a slightly unladylike position, I'm sorry.
Oh, baby,
Hey.
it's okay, it's okay.
All right, so flip it like that. There we go. All right, so we're not talking about this, are we? Which is
That's been with us.
this hernia. Yes. Okay, so that's just a outie belly button, umbilical hernia.
It's here. I noticed it because she does actually enjoy lying on her back. I just noticed it popping out when she's lying in certain positions.
So that does feel like potentially a liver mass.
Yeah, that's okay.
What we'll do is we'll let her lay back, and I just want to have a feel with her now standing up. There we go. Good girl.
Very good.
Okay. And has she been sort of well in herself and eating well? And
Yeah, she's been eating well and she's been well in herself, but she does seem to have lost a bit of weight.
I can feel that her liver is very big. The lump that you can feel through the skin is in fact one of the liver lobes.
What could have caused that?
Well, you're not going to like the answer to that. This one feels like it's on the liver.
Sorry, okay.
Yeah.
At the Richmond practice, Scott's concerned about the mass that has been found on 10-year-old Honey.
What could have caused that?
Well, you're not going to like the answer to that. She is showing classic signs of some type of cancer.
It's devastating news for Honey's owners, with their little Shih Tzu already battling a serious heart murmur and inflammation of the brain.
It's hard to hear, isn't it?
Yeah.
When you hear the word cancer, you immediately panic bells start ringing, don't they? So, you know, it's just probably as serious as we thought it could have been. So we just got to keep our fingers crossed that Scott can work a bit of magic on it.
Scott now needs to take Honey downstairs to take samples from the mass on her liver, so they can be sent to the lab for urgent analysis.
Honey is so brave, and I think she's a lot braver than us, actually.
Come on, gorgeous.
Oh, there you go,
All
baby.
right. All right, do you want to give Mummy and Daddy a kiss?
Bye-bye, gorgeous. Bye-bye, baby.
Okay. There's the fan club.
She's been through so much. It's sad to tell all of our friends and family, really, because she's loved not just by me and Barry, but by everyone.
Hello.
Hello.
This precious little lady is Honey.
Hello. Look at your pretty bows. Very cute.
Isn't she an absolute sweetheart? Oh, well, unfortunately, I'm a little concerned about what we're going to be finding today. She has been losing weight, and her mum's found a lump, which she thought was on her tummy, but actually is what I can feel to be a liver mass.
Oh, that's sad news, isn't it?
In the treatment room, Nurse Sam's ready to help Scott take samples from Honey, but there is a complication.
The kicker to that, which will make you, as her nurse, quite nervous, is that we have to do it all conscious.
Great. Why?
Well, she's got a massive heart murmur. She has done for quite some time, and that's a massive compromise to the anaesthetic. So we'll do everything we can to support her right now, make her as comfortable as possible, and hopefully she'll just let us do what is a pretty mean thing, and hopefully she won't hold it against me. So what we're going to do with Honey is give her some pain relief to start with. We're going to locally anaesthetise the site as well. We're going to do everything we can to make this as pain-free as possible and get the cells we need to make a diagnosis. Nice, deep breaths. Let's all be calm for her.
With Scott not willing to run the risk of a general anaesthetic, this has now become a very delicate procedure.
Okay, everyone ready?
It's a good girl.
Not to worry. So that is not blood that's come out of a blood vessel, but actually blood that's present in this tumour. So fairly nasty type of tumour. When there is a lot of blood cells present in a sample, it can affect the ability to interpret the result. So I'm a little concerned we might not find out what's going on with Honey with these tests.
Good girl, Honey. Good girl.
I would be very surprised, shocked even, if this doesn't come back as cancer. Never have I wanted to be more wrong. Don't want to be right this time around.
Upstairs, an anxious Nikki has been waiting for Honey to recover so she can take her home.
Where's Mummy? Hey? Where is she? Hello.
Funny. Hello, girl.
There she
Hello, my
is.
girl. Hello, my gorgeous one. Oh, what's happened to you? Hey? Oh, so she was good.
She was just an angel. Didn't make a sound. Brave as they come. But the sample was quite concerning in that it was a little bit on the bloody side, which you might think, oh, yes, he's just hit a vein, but that's unlikely because of how much came out in a short space of time.
Yeah.
But we just need to know what it is first.
Okay.
So,
Okay.
how are you guys feeling about everything?
A little bit shock, I think, really. Although we've been contemplating what it could be, it's still not nice. It still feels quite...
Well, you guys are such optimists, I can tell, and so you always think, oh, hopefully it's nothing.
Yeah. I think Barry's more positive thinking than me, but I will definitely try my hardest to stay positive over the next few days until we get the results, and give her lots of love and lots of cuddles until we find out what the treatment plan will be.
Let's make this happen.
At the St Margaret's
Scott,
practice,
okay.
Nurse Emma and
Get
receptionist
snuggled
Elle
in.
are plotting
Come
how
in
they
close.
can convince their boss Scott to let them keep George.
Unfortunately, there is a tall blonde Australian vet that kind of hangs around with us, so I do have to ask his opinion on certain things.
The ginger cat was dropped off to them severely underweight.
Hello.
Hi, Scotty.
Hello, ladies and cat.
Cat's the main reason we're calling.
Okay.
The best way to get around Scott Miller is to flatter him first. So, you know how we really love you?
Oh, of course. Go for that saying.
And you're so handsome and a really good vet.
Wow, this feels really loaded. This is the kind of way that my kids get stuff out of me.
Yes, I'm using the exact same tactic. George needs a forever home. So we have been discussing for a while how we would really like a practice pet. And we feel that George fits the bill. And since it's my birthday, I have extra power here.
Yes, okay. Am I getting out of the present if I give you George?
Okay, I can make peace with the big ginger cat as my birthday present.
Yay.
Okay, well, why not? I think we're going to have to read the vet clinic, the ARC.
Oh, George, do you hear that? Elle and I are absolutely over the moon. Scott said that we can keep George as our practice pet. We need to feed him up and get him back to full health, but hopefully he will just become part of the family and settle in really well.
Good luck with all those strong females around me.
He's definitely got a lot of cuddles to catch up with, and I'm very happy to give them, as are all the other nurses.
Bye, mate. Good luck.
Bye! See you later! In the bag.
Yay.
In the bag, George! Yay!
Come on then, mate. Let's go see the girls, hey? Let's go see your adoring crowd. Hiya! Hey, Jean, how are you?
Hi, I'm good. How are you?
Good. This
How are you?
is Cecil.
Surgery is now about to go ahead on 3-year-old Cecil at Scott's Isleworth practice. Nurses Gina and Gemma are going to be assisting Scott with the surgery.
Hi, Cecil.
Guess what the problem is?
You can't breathe.
Pretty much. He makes that noise all the time. Don't you, mate? Does it remind you of anyone?
My dad after dinner.
Oh, really? You go. You sound like Gina's dad. That's no good, is it? We're going to have to sort that out. All right, well, we're going to probably have to do 2 procedures today. The first is just the fact he has no nostrils, so he's going to have a nose job. Okay. And the second is once we've knocked him out and I can look down the back of his throat, I think there's almost certainly going to be an elongated soft palate, so we're going to have to trim that. So 2 procedures in one day. He can't exercise for very long because otherwise he collapses. He can vomit when he gets really overexcited. And then when he gets home, he pants for a good 10 or 20 minutes before he calms down. So I think Annie is feeling very worried about her little boy today. And the procedure that we have to perform today isn't a simple one. It's one that comes with risks, as do any anaesthetic. Okay, how's that? It's pretty good. So what I've done here is made a bit of a contraption for Cecil's head, which is gonna allow me to better visualize all the structures at the back of his throat. Straight away I can see he has an absolute monster of a soft palate. It's going right down into his windpipe and it's causing all the problems that he's struggling with. What I need to do is to trim away some of that so that it doesn't go down and back over his windpipe. Gemma, if I get you then to hold that and just pull that out a little bit for me. In order to trim the soft palate successfully, I've asked if Gemma can help me with holding some stay sutures, which I've placed, and that allows me to really see it in all its glory, and it's massive. So it's great for Gemma to have that bird's eye view. It does mean that she is giving me a cuddle while she's doing it, but she does seem to be enjoying the surgery. So what we need to do is to try and take away some of that meatiness there. That's a much shorter soft palate that's now not impinging on the windpipe, and he's going to be able to breathe so much easier. I'm sure that this moment, whilst he's under anaesthetic and has a tube down his throat, is probably the first time in his life he's actually breathed properly. That's it, good. So that's part one done. Now part two is the nose job. The nose job isn't particularly tricky, but it is very bloody. What we've got here is the nostrils are just very narrow. There's just virtually no hole there whatsoever. So what I want to do is to flare them out to allow for a bigger hole and therefore more air to flow through with each breath. So he has nostrils. So what do you think?
There's such a huge difference there, and you can see he's actually going to be able to breathe now.
Yeah, I just hope he likes his new look. Will it be obvious if Cecil's had a nose job to everyone he knows? Maybe. I think more from the fact that he's going to breathe so much better, but unless he's got a mirror at dog level, I think he'll be just fine. There you go. Listen to how much quieter you are already. Yes. Aren't you? Yes, you are. Good boy.
A few hours later, Annie is waiting impatiently to be reunited with Cecil. The French Bulldog has recovered so quickly that Scott is happy for him to go home.
I was worrying all day, so I've just been sitting at home and just waiting for Scott to call me. Oh, his nose!
Those, Annie, are called nostrils.
Yeah. Oh no, it just looks better now.
Yeah. Annie seems very happy to see Cecil and not too horrified about his nose. I think I've done a good plastic surgery job on it. Of course, he is breathing much better, which is the most important thing. Hopefully no more collapsing and much more having fun with your mates in the park, hey?
Oh my God, he does look really different, but it does look good now, because before it's just like two little tiny little slits. So now it looks like he can actually breathe through his nose.
All right.
Okay, so...
He's like, let me go home before that guy takes any more of my face off.
Well, thank you so much.
My pleasure. Here you go. Good lad, your baby's huge. Bye, buddy. Bye, handsome boy. With your nostrils and everything. And your quiet breathing. Hey, good boy.
Thank you.
All right, take care, Annie. I'll see you soon.
Bye.
Bye, boy.
Bye.
See ya.
Bye.
Bye, mate. Ah, what a cutie.
Allez, porte! Oh, good girl!
Scott's next patient, 7-year-old Elise and her French-born owner Marie, share the same love for high-energy agility competitions.
When she does well in agility, I feel so proud. I feel like a peacock. I mean, I just bloat of pride.
But for now, the Beagle's on the injured list and restricted to outings in the local park.
Elise! Elise has always had a weird gait. She's always kind of had a hula hoop movement with her hips, especially when she transits from walking into a trot. But lately, she has started hopping, alternatively on both legs, and then pushing like a rabbit. It looks uncomfortable, it's new, so I need to know what it is.
And she loves the back scratch and the bottom rub.
Marie adopted Elise when she was just a puppy. At the time, Marie was struggling with serious health problems.
I was going through a very, very difficult patch of my life. I had just gone through a major burnout. Clinically diagnosed, no motivation, no interest in anything anymore.
I mean, I poked her. Yes, good girl.
She brought back me having to care for something else. And I hope I'm giving her as much as she's giving me. Elise!
Now it's Marie's turn to support Elise.
I always get very worried, what if something goes wrong? So if we have to do surgery, we will, and it will really, really be last resort.
Hi, Elise. Hello, beautiful girl. How you doing? So what's she in for today?
After one of her agility sessions, she went a little bit too quickly on the seesaw and did a flying beagle, which means that it went up, bump.
Right.
And
that's not a technical term, I'm assuming.
No,
that's just her trying to fly.
That's it. With those big ears, you would assume there is some lift.
A bit like a Dumbo sort of thing. You'd hope so, wouldn't you? Yeah.
But no, so she's been hopping one leg, the other leg, and then both legs.
Does it seem to get worse with exercise or after exercise?
After exercise.
So which leg do you think hops more? You can't really tell.
I can't really tell. It's really intermittent.
There's a bit of tenderness in the knee there.
Shibus.
Yeah, a bit of soreness there, so that's interesting. Okay. I'm just now checking the cruciate ligament. Ooh. Sorry. So, you're okay. Wow, that was a pretty extreme reaction. So just what's causing the pain in Elise's knees? Well, it could be anything from a torn cruciate ligament to a small fracture, which would need surgery, to something that just needs a bit of medication and rest. I know. With Elise being so jumpy and nervous, there's no way I can carry out a full examination of her legs without sedating her. But we'll also need to complete x-rays to confirm the diagnosis. Come on, there we go. Oh, I know. I can feel just how stressed both Marie and Elise are. All right, say goodbye to Mummy.
Bye, Beagly.
Marie clearly loves her agility classes with her beagle, and the thought that surgery might put a stop to their favourite pastime will be really difficult for both of them to cope with. This is one nervous little Nelly, I can tell you that.
Oh, bless
Yes, her and Mum have got themselves wound up, haven't they? Haven't you? It's not that bad. It's not that bad. All right.
Oh.
Let's give her the sedation.
Wow, she's a bit jumpy.
Hey, good girl, that's it. Calm down.
While Nathan and Scott try to pacify Elise,
good girl.
Upstairs, Marie can only wait and hope for the best.
It's very distressing. It's worse than if it was happening to me. I get very, 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 very anxious.
Oh, you're bouncy. Oh, you're bouncy. Come on. Relax, relax.
It's okay.
Barry and Nikki are riding their own roller coaster of anxiety. The samples that Scott took of the mass on Honey's liver have come back as inconclusive. They're now hoping to find answers about their 10-year-old Shih Tzu at Scott's referral hospital, the Royal Veterinary College.
So I've spoken to Scott and we have agreed that the best way forward is to get better pictures of this liver.
Specialist Dr. Stein-Nielsen will be in charge of the investigation.
She will be treated like a VIP.
Oh, good.
VID, I guess.
That's what she's used to.
That she is.
Okay, baby. I'll see you later. Honey's just everything to me and Barry. She's a massive part of our life.
Good girl.
There we go. There we go.
I just hope that when she comes around from the recovery that we've got some answers and we know what the plan is to go forward.
Good girl, honey.
Let's go to sleep, little one. So the plan for today would be first to put her through the CT scanner.
Good girl.
Looking at the images, it's one of the biggest livers I've seen in a dog of this size. You can see it's not the same color everywhere. You've got some darker bits, lighter bits. It's all very blotchy. That's not what we normally expect with a healthy liver. whatever is going on there is growing in a big way. We'll try to also have another go at taking a little sample of that liver. We are going to use a bigger needle than Scott used. And that is advantageous because we will get more tissue and we stand a higher chance of actually making a diagnosis, hopefully giving us that answer whether or not it is cancer.
As Honey's samples are fast-tracked in the lab, Barry is anxiously waiting in the RVC reception for the results.
Hi there, Mr. Wilson. Okay. You are...
baby. Can I take her?
Yeah, of course.
Hello, baby. Hello. Here's a good girl.
Shall we go to a room and have a chat?
Yes, please.
Okay.
Come on, girl. Come on. Here's a good girl.
So we managed to do everything, which I'm really pleased about, because I think we've got now the best possible picture of what's going on there. And I have to say that that is not good news in that we do have cancer.
The results show that Honey has advanced cancer of the liver.
Now, some types of these cancer you can perform surgery on. With her, there's very little normal liver left. So I think she's coping better without doing the surgery than if we were to do the surgery.
It's hard to explain, really. I'm not really emotional. I'm not really an emotional person, but when you hear the words, Honey's got cancer, I didn't know what I was going to do. It's the worst possible news that we could have had.
This is a slow-growing tumor, but how long is probably the question you're going to ask me. That I can't answer. That is something we'll just have to see. And although it's not what we wanted to hear, we can now make a plan for the future, because she still has a future. And maybe we'll be surprised at how long she still will do well.
It's best if that we know, isn't it?
Absolutely. As long as she's eating and drinking and being happy when you come home, you can say honestly to yourself, she's got a good quality of life. There's no urgent action we need to take. So that puts us in a privileged situation in that we can now make quite a quick decision to make sure that she doesn't suffer. But until that time, we can have a lot of good days with her, giving her the best possible life, because we will have prevented any suffering.
Although it's devastating news and it's awful thing to hear, I'd rather know in advance and we can make it as perfect as possible for her. You know, all we can do is make however long she got left special.
There we go. There we go. There we go. Oh, you're bouncy.
At the Richmond clinic, Scott's attempting to find out why 7-year-old Elise is suffering from lameness in her back legs.
All right. Let those nice, happy drugs take effect, yeah? I'm dealing with a very nervous patient in Elise and her equally nervous mum who's waiting upstairs. There we go.
I'm feeling nervous, really. I mean, it has revved up my anxiety.
I've got a concern that she might have some injury to her cruciate ligament. She cried out in the consult room. She was quite sore, so I just want to see if there's any movement there. After examining her legs, yes, there is a tiny bit of movement there, but I do feel that the cruciate ligaments are intact. So now I need to do the x-rays to just give a clear diagnosis. Okay, I'm happy with that. That's all good. Marie absolutely loves this beagle, and they're both addicted to agility classes and exercising together. So let's hope that we're not going to find anything that's going to spoil their fun. X-ray. Parlez-vous Australie? Oui?
At the Richmond practice, Elise is waking up after her x-rays. Scott's trying to find out why the 7-year-old beagle is suffering from lame back legs.
Mon chéri. That's French, right? Oui bien is... Oh, maybe they're the same.
Muy bien is Spanish.
God. S'il vous plaît? Croissant? No?
When Scott attempted his French, I think he went through about several different languages before he got to the right one.
Oh la la. And all that sort of French stuff. Hey, yeah. Hey, good girl. Well done. Elise is waking up beautifully despite my horrible attempts at speaking French to her, and now it's time to go and get Marie. I know just how on edge she'll be right now.
Oh, dopey Elise. Hello, dopey princess.
You're still a little bit sleepy, aren't you, sweetie?
Oh, I think she is.
Elise loves her agility competitions, and owner Marie is hoping Scott's diagnosis won't spell the end of her beagle's favourite pastime.
Let me quickly show you these x-rays. So, the good news is that there's not major injury to any of the joints. But what there is, however, is quite a significant amount of inflammation in both of her knees. So when she jumped and she squealed when I felt her knees, that was for a very good reason, because actually they're quite inflamed, quite swollen. What we've got here is a classic x-ray showing a dog with joint effusion, which is basically extra fluid in the knee as a result of a potential ligament injury. Instead of a big white fat pad here, there's a black triangle, and that means the knee is full of fluid. This flying beagle has hurt herself in agility, but has not wanted to let her owner, Marie, know. So Elise has soldiered on and continued to exercise, but that inflammation and potential ligament injury is just getting worse. You've been a runner in the past, and so I think you can relate to this. Is actually, as much as you don't want to do it, actually we need to rest her. We need to give her a good 2 weeks off of doing nothing.
Really?
She is going to sleep on the couch. She's going to be having a wonderful time, but no walks. Because,
Really?
Yes.
Wow. Okay.
Because the thing is this is purely inflammation. I'm hopeful that there's no structural damage, but what we need to do is just give it a chance to get better. And the only way we can do that is by resting her.
Wow. I'm feeling so relieved and actually really ecstatic right now because the diagnosis on Elise is actually something quite manageable. So this is definitely something I can relate to because I've got fat pad injury.
Right.
So, and that was it. Not 2 weeks, I was 6 weeks.
After that resting period, to try and get Lisa's legs moving a little better, I'm suggesting alternative therapies. So things like hydrotherapy, a great way to keep good flexibility, keep the legs moving, but don't have any impact on the joints.
She is not a good swimmer. She's already nearly drowned once in the lake. Someone had to dive in to rescue her.
Wow.
So I hope they're little life jackets wherever we go to do hydrotherapy.
Thankfully they are, yes. In a lovely fluoro colour, which hopefully she'll find quite fetching.
Pink? For Madame Beagle?
Oh, maybe so. It might cost you a little extra, but hey.
Hey, fine.
And no
Anything
expense.
for my beagle.
Exactly,
Yeah.
exactly.
Anything for my beagle.
Yeah, you like it up here because you can see everything, can't you?
At St Margaret's practice, the latest addition to the family is still getting used to his new home.
George has come on amazingly. His purring is incredible. It vibrates through the whole building. I think it's lovely.
All that sort of dandruffy stuff is all gone. I mean, look how much better his skin is looking as well. It's not looking as dry.
Oh, and look at his mane. Look, he has actually got his colouring of a lion. Look.
It really does.
Since Emma and Elle convinced Scott to keep George as the clinic cat, he's been getting VIP treatment.
I think George has found his home where it's full of love and lots of care.
Well, hello. I feel like I'm intruding.
You are slightly.
But there's one important person who still has to make George's acquaintance.
Hello, handsome boy. Oh, he's really slumming it here, isn't he? Seems like he's enjoying a bit of grooming. I know why you love him, because you have a bit of a type for a ginger bloke, don't you?
All right, all right. I do love a ginger.
Pooing Uncle Scotty, yeah?
He's still a bit bony, but is he putting on some weight, Elle, now?
Yeah, he is. He's putting on a little bit of weight. He likes little meals, little and often.
Okay.
So just building him up.
It's very obvious that George has had a tough life. He's very thin. He has a lot of condition that he needs to put on, but he's certainly in the right place for that.
I hear this is your favourite at the minute. Oh, you smell that one.
Well, he gets better service than I do.
Oh, yum.
He seems very happy here. Long may he reign in St Margaret's. It really feels like he's already part of the family, doesn't he?
He really is.
Yes.
He's like hotel vet on the hill. Who wouldn't want to stay?
Absolutely.
5-star treatment, isn't it?
Nothing but the best.
ready? Are we ready? Come on, that's it. We can do it. Good girl.
As for Elise, after 2 weeks of rest, the injured beagle is now ready to get in the deep end with canine hydrotherapy specialist Nikki.
Good girl. Good girl.
The playful beagle developed inflamed, swollen joints in her back knees and now needs to build up the strength in her muscles.
Elise is fab. She's a great little patient.
Very good.
We've focused on working her in the pool. Obviously, it's non-weight bearing movement, so it's very safe for joints to work in the pool. We're not going to strain anything.
Oh, wow. Good girl.
This is a bit like Pilates for people. It's exercising the core and asking her to balance.
Let's go. Good girl.
Although Elise is doing well, the beagle will need several more sessions in the pool before she's ready to return to her agility training.
It'll be great when Elise is back to her old self and when she doesn't have her hop anymore. I'll have my beagle back. Ah, that's a good one. That's a very good one.
Wow, almost sheepy.
Mummy's been warming it up for you. Oh, come on then, there's a good girl.
It's been 3 weeks since Honey was diagnosed with liver cancer. So far, there has been no signs the little Shih Tzu is in any pain.
It's a nice bit, isn't it?
And owners Barry and Nikki are making sure Honey has everything she wants.
One more.
Honey's behaviour has changed, yes. So because she's been getting spoilt every day, she will only eat roast chicken, and it has to be hot.
There's a good girl. Lovely.
I'm really glad that we went ahead with the CT scan and to know the result, really, because it means we can spoil her every day more than what she is already.
After such devastating news, Scott's stopping by to see how they're all coping.
Well, someone's sounding feisty.
Hi, Scott.
Hey, Barry, how are you? Hi, Nick. Good to see you. Hello, gorgeous.
Just to say hello.
Come on.
Come on, baby. Good girl. Honey is very clearly the boss of this house, and although she's unwell, she doesn't know it. She is really taking advantage. Yeah, and she's living it up. She's got her own cushion, new toys. I mean, this is all sounding pretty good.
It's a dog's life, isn't it?
Yeah.
Thanks for all your help. You've been really supportive.
If anyone can live a long time and eat you out of house of roast chicken, it's going to be Honey, isn't it? Hey, you good girl. Yes, you are.
Honey doesn't know that she's sick at all. And she's so in tune with my emotions that if I show that I'm upset, she'll come straight over to me and be like, why are you upset? What's wrong? And Barry keeps saying to me, there's always time to be upset afterwards, so try and enjoy every minute.
And after 2 weeks of total rest, followed by lots of rehab,
On va aller travailler. Attends.
Marie and her excited beagle can finally get back to their favourite place.
Resting Elise, no activity at all, was very, very difficult to manage. She's an active dog, so I was really eager to get her back into exercise mode. En avant, saute, tu lèves. En avant, saute. En avant, saute. Elise, right, saute. Monte. Elise has been great today. For first time back, she hasn't forgotten the moves. I may be a bit more rusty, but she knows her job. Saute.
It's so fantastic that Marie and Elise are back doing what they love most. I know it's been difficult for Marie to keep this beagle from running around, but my instructions for complete rest were carried out to the letter, and now we have a perfect result. Everyone's a winner.
Whee! Bravo! Whee! Good girl. I think she was very happy to be back. I saw a very enthusiastic dog, so that makes me happy. She's a happy dog.
Up.
Elsewhere in southwest London, things are a whole lot quieter for Annie since Cecil's operation.
The nose job's worked really well for him. He's not struggling to breathe anymore. He's not catching his breath after he's playing.
Today, Scott's arranged to take the French Bulldog for a test drive to check out his progress.
Wow, he's even trying to keep up with runners now. Hey, you're a happy boy, are you? Walking in the park with Annie and Cecil is a delight because now we can do it and actually hear each other speak. Cecil is so much quieter, he is breathing so much easier and just enjoying himself as a normal, healthy dog should.
I'm really pleased with what Scott's done. The results are amazing. And I'm happy and Cecil's happy.
You're absolutely bonkers, aren't you?